Well, good afternoon, everybody. Hey, hey, hey. It is the Dr. Sheri here with Power Tables. This is where you bring the lunch and, well, we bring the tea. Yeah, we got it here. Our wonderful cup of tea. I've been drinking dandelion tea for just a little bit with a little bit of licorice and some turmeric, and just makes for healthy vibes all around you. I'm telling you, the anti-inflammatories and this thing alone is worth the cup of tea. So I hope you've had a great July 4th, which was on yesterday, where our nation celebrated its Independence Day. And so I hope you were able to enjoy some of that with family as well. But you remember earlier this week, as I see you coming in the room, we were talking about sharing on this month National Mental Health for Minorities on this July month. And so we want to bring a little bit of awareness to that, or join the awareness movement, as the case may be, and to share a little bit of the history of that, as well as what the stats look like today, and then some of the things that we can do to get involved as we drink our tea. And I had a wonderful experience on yesterday with our family. And I got to tell you, I realized a missing piece of that puzzle, which we're going to share with you on today. But at first, we want to share a few of the stats, or one alarming stat to me. And that was simply that we have a company by the name of Lyra, and they do surveys across the nation. They surveyed about 250 different companies. And when they did that survey, it's not only the companies, the leaders themselves, but also their employees. And they asked one particular question: how important is a mental health benefit to you? Now, this is across all genres, ethnicities, diverse cultures, etc. So they asked that question: how important is that to you when it comes to your insurance? They had an astounding 96%. Yeah, 96% of the employees that said it is very important, not just important, but very important. And then they asked the same question to the leaders. Interestingly enough, the company leaders, that result was again an astounding, but less than enchanting 36%. Yeah, almost three times the number of employees thought that mental health benefits were important or very important, versus the companies, the employers, the people that employed them. Now that's astounding, because it means that the employees are perceiving a problem which can be met through their insurances, and they can have not just availability, but accessibility. And the employers did not feel the same. They were at a very alarming 36%. So, with that being said, before we can even talk about the diversity, before we can even talk about the ethnicities, or the backgrounds, or lineages, or ancestral connections, we've got to talk about what's happening at the level of employment. If employment agencies don't think that mental health benefits are important, we can't even begin to look really or delve into the socioeconomic backgrounds of it. But we want to talk about something we can do as I sip on this wonderful tea today. I looked at my own family on yesterday, and we had quite a crowd and we were so excited. But one of the things that happened is that all of a sudden, the cousins and the uncles and the aunties, we all gathered at a place that's very common to us in our culture, and that is at the table. Everybody was sitting around the table. We had had lunch, we had laughed, we had enjoyed memories and different stories of loved ones now gone and loved ones that are still present. But at this particular time, they began to talk about health and what that looked like for each one of them. And I'm going to share some things with you. We cannot forget the W's. Many times we think about that with respect to news stories. And when we talk about the W's in the story, the what, the who, the what, the where, and the when of things, we don't think about that as it pertains to our own family. But yesterday we did. And so we had all the who's around the table. various ages. And one by one, they began to share certain health things that were going on with each one of them. That's the who. We got to get down to who is being affected. And until we actually speak, we may not know what's going on. But at the table, after a great meal, everybody felt comfortable about sharing who was being affected by whatever disease state it was. We found out there was hypertension. We found out there was diabetes sitting at this table. And yeah, we'd put the Ritz on. I got to say that. So we had people go outside, walk around a little bit, or drink you some water and get your blood sugar back down. But they began to talk very openly, very candidly about how these disease states had impacted each of them. And while some of them knew about histories, even of cancer that ran in their families, they didn't necessarily know the next thing, always what to do about it. With respect to the what, we began to talk about, medications. Understand, I am a licensed physician in the state of Texas. I am board certified in my specialty. So I'm very qualified to talk about it across the board, professionally and still personally with each of my family members. Although we don't always push that down their throats, we're just happy to see everybody sitting at the table. But I realized that each one of them, as they shared their accounts, their historical health accounts about what was going on in their bodies, it was actually helping me as a healthcare professional. I've had the interesting privilege of serving in a private practice for 15 years, and then to serve at an executive level now in corporate America, where I'm able to see kind of a bird's eye view of what's happening across the nation in health. But many times I think of that as just my professional due diligence. I don't think about it many times with respect to my family and what we can do. But yesterday, they taught me as they began to talk about the who, but then the what of this health and what it looked like for them, what medications they were on, what side effects they were having, what they experienced in their body if they had a positive effect, how often they were going to the doctor. Maybe some of them had not gone to the doctor. Maybe some of them were avoiding because they felt that their A1C, they knew about that with diabetes, was getting out of control. They had their blood pressure cuffs and hadn't been looking like they wanted it to look. And so they were doing some cultural things, the vinegar, etc. Okay, some of you have heard about this in the African American culture, Black culture, whatever you want to say at this point, whatever is politically correct for you right now. But they were doing things to help themselves. So they thought. But while they were doing this, we were all learning about each other. And then as I saw that what of the healthcare industry, that what of the health, the impact on health in various communities, beginning with my own family, we listened from the who with the cousins to the what, and then where can I go to get help? Because some of the disparities that each of them spoke about was not just sometimes the access as far as transportation. They had that. But sometimes it was the finances. Yeah. And that's largely what they were finding. That when they got there, even if they had healthcare insurance, sometimes it wasn't enough to cover maybe the medications or the various treatments they were told about. And so they had to make decisions. Do we take care of the mortgage? Do we take care of the utilities? Do we take care of other things that we need? Or do we get this medication? Do we go and get this particular treatment? And so, sad to say, we were hearing at the table that their where was very limited because of the finances. They didn't know about additional resources, which astounded me. Because in my 15 years of practice, one of the things that I love to do is to know where my resources were for the sake of my patients. I knew where they could get help. I knew the specialists in my area that were at the top of their games. I knew the facilities that were around me and what they offered. And so what would be best for my patient. Many times, even though I was in a rural area, and some would say that's underserved. And we'll talk a little bit more about this as the month ensues. But although I was in a rural area, some of my patients who had received procedures or even surgeries would call back and ask, "Would you please have them transfer me back to you?" Why? We knew how to care for them, even in a rural setting. We knew how to make it work because we had our resources available and we tapped into them. And so my patients were very astute when they went to other areas, other specialties, because I educated them. It was not just to see them, to evaluate them, to make an assessment and to come up with a plan. But if they didn't know the resources, I had not done my job. And so we worked very diligently at that. But I realized yesterday at the table, the where, the where had impacted my culture, had impacted the ethnicity and my ancestral heritage, had impacted my family sitting at the table with me. I realized as a healthcare professional, I had not done due diligence starting with home. They always say that charity begins at home. And that's where we need to perhaps restore some things. As I heard one of our new family members come in and say, this is what's been missing. Because when we would get together, many times we would meet at the table. And it was in listening to the who, the what, that we were able to determine the where of situations. And she said, we need more of this. We've got to go back to this because it's at the table that sometimes we hear the resources that are vital to our health. And that's how we go on. As they sat at the table, I listened to two cousins of mine hear everybody's story as well as share their own. Each of them have been involved in the social area. Each of them, one of my cousins has worked for human resources for almost 28 years and knows very well what the resources look like. I have another cousin who's worked in the community and works now with her husband, who is a pastor, and they work at least twice a month with the community as far as food pantries and health resources. And he works with the youth as well and educating them at that level so that by the time they get to our age, they're well versed on what the resources look like. But each of them offered resources to our family members who were having some difficulty, and candidly and very openly, and I'm so thankful for that, mentioned where they were being challenged. I saw the solutions come to the table. Listen to me. After the who and the what, I saw the solutions of where come to the table through those two individuals. I never had to say a word. Healthcare professional in the field for almost 30 years, practice, executive level, saw it at its height in the pandemic just a few years ago and how we had to make quick changes for the sake of people's health. But I saw it come to my house as they shared the wheres, where they could connect. They told them about medications. They told them how to access pharmaceutical companies because they have those programs which help those who may not have insurance or have insurance that doesn't cover everything. But they didn't know that these were important. They didn't know in some cases that they even existed. I saw my cousin who'd worked with human health services for over 28 years or almost 28 years sit there and show them on the phone. This is where you connect. This is how you connect. And then worked patiently with her as she was almost trembling. And she said, no, take your time because you're going to get it. And then I want you to go ahead and take a screenshot, save it to your phone so you don't have to look for it every time. This is how you get that medication, which was an astronomical number to her with respect to their budget. They're on a limited income. Both are retired. And so $500 may not have meant much to someone who's still working. And in some cases, it still does. But to her, you could have said $1 million because it was impacting their household budget. And they did not have that expendable income to purchase that medication. And her response was, I'll do without it. And we said, no, you won't. You will get the medication. Here is how you go into those. So you need to speak to your physicians, your healthcare team about patient advocacy programs that exist within your state, wherever you are listening to me. They exist within the pharmaceutical companies because they want to help the patient. Not only that, it's a plus for them. It's like they get that little extra thing because you get to go out and tell others how well this medication is working. There are also hotlines that give where they get feedback from you on if you have a problem, an adverse effect. They want to know. Why do they want to know that? Because that helps them to tweak that medication and make it better, not only for you, but for those who are coming after you who may need this medication. So in a sense, it's a win-win. Not only do you get that medication, should you be approved, you can get this medication for a year. They deliver it to your doorstep free of charge. The Good RX and all those things that we hear, which can be supplements to your insurance. That means just because you have insurance does not mean that you can't utilize this program. But if you don't know it, you don't know where to go, then you can be doing without vital medication for which you need. And I hope you go ahead and tag in and let me know where you're hailing from, because I'd love to share with you a little bit more. Why are we sharing these things? Because these are the things that are impacting health. These are the things where we see increased risk of stroke, increased risk of heart attacks, increased risk of cancer or cancer satellite areas. Many times it may not be the exposures on the outside, but it may be things on the inside for which we haven't been exposed to, which is where are our resources? And nobody's talking because we have the lost art of being at the table and having these conversations. I remember as a little girl, we'd sit around the table. Yeah, we'd learn all the family tea, if you will, but also more than that, we found out what was going on with each other from a health standpoint and what we need to do about that, what that looks like. Yesterday, I saw it firsthand, and we're so happy to have technology. We're so happy to have these social platforms so that we can bring information to you across the board. We're able to bring information now in real time at all levels, but this is a lost art. This is a lost art. And I realize every culture has its at the table moments in the way that you do it according to tradition or whatever that is, but we've lost it. Text messages have replaced how are you? And we bypass it very quickly. Or maybe a social media greeting. And we don't sit face to face where we're able to see one another, actually connect, and then to actually hear that person's story. On yesterday, we were able to do that. And so with that information, I saw cousins come to the light. I saw them make connections on their phone with these pharmaceutical companies that want to deliver the medications that you need to you. You don't have to pay out of pocket once you meet that criteria. But if you don't know what it is, and you don't know there are patient advocacy programs, not only around you in your local communities and nationally, but also with the pharmaceutical companies for which you interact with, the ones that produce your medications that you take. And you can be a healthier you, because that's what this is about. Removing the stigmas and the disparities that affect our health. What are disparities? There are differences, maybe across the genres or across the ethnicities or the cultures or whatever it is that causes us to not be at our most healthy us. Anything that interrupts with that can be a disparity, even if that's a financial disparity, a cultural disparity, maybe it's a language disparity, maybe it's a language barrier, whatever it is. But today we're talking about what we can do as families. Before we talk about the communities, before we talk about healthcare and our physicians and our our nurse practitioners and physician assistants and providers and physical therapists, and the list goes on and on. Before we even talk about that, before we even talk about our government, because I know we like to talk about that a lot, there is something we can do. Sit at the table with your family. Maybe it's time to bring back dinner. Maybe we can't do it every night, but maybe we can do it twice a week. See what's going on in your household. You would be surprised. Yesterday was that surprise to me, but I saw how quickly that once the problems were introduced in the who and the what, the where came very swiftly because of others' professional backgrounds. They brought it to the table. I was able to listen and to learn, and now begin to add a piece of that to my professional medical arsenal. When I talk to patients, when I talk to other providers across the nation, I can now say, again, as we once learned in some of the basics, because sometimes we get so technologically inclined, we may overlook some of the basics. When we used to say, tell us about your family. What are the dynamics like? What can they bring to the table? Because when you include family, you've included a vital piece of the healthcare team. Yeah, I did say healthcare team. That's who they are. It does not matter that they don't have medical training. Many times we minimize that. And sometimes we will completely overlook it. Where they're not medically trained, they may not be, but they're familially trained. They know that family. They know their inclinations. They know what they might do and what they might not do in a given health crisis. That is a piece of the puzzle that you and I do not have as healthcare providers until we ask the question or we invite family members in. Yes, I understand there are limits to everything, but it's a vital piece of the information for which we have overlooked. And I saw it yesterday at the table. Bring your family to the table. Find out the who that's being involved. Find out the what that is occurring. And sit down and talk about the where you may be able to get some assistance. And let me add the last W, the when. When do we do it? Now. Why? Because now is when people are being affected. Now is when we see individuals at 40 with strokes, and they've got another 20 to 30 years to go. No, it didn't kill them. And while we are excited about that, it did alter, it did impact the way that they live, their quality of living. And now it has not only become a burden to them, but a burden to the family. We've got to make some adjustments, y'all. The cancer that nobody wants to talk about in the family, but it's affected the last 3 generations, and no one has said anything. Why not? I still remember when my mom was living, and we had a cousin call us who's still with us, and she mentioned a particular surgery that she had had. And we were on the phone. She just happened to call. My mom said, "What? What did you say?" And she said, "Talk to my daughter." Not too long out of medical school, but I knew the terminology well. She said, "Arnold Chiari malformation." And I went, "What?" She had left Louisiana, gone to California to see a specialist, had the surgery, and was back, not knowing that my mom and my mom's younger sister had had the same malformation, and both of them had had surgeries by one of the top specialists in Houston, Texas, all because we had not sat at the table. When she heard this, she almost gasped. She said, "What?" She said, "I got to share this." She called the specialist in California who said, "I don't think we've ever heard of this going through families in this way. Do you mind if I receive your records?" Both my mom and my auntie were too happy to share. He did a case study on them, which was able to help others and talk to other families and family members and say, just in case you start experiencing this, and then you see this in siblings or maybe even your children, let them know. We would not have known without that conversation. And so we were able to share this with other first cousins. What are we not sharing now that could help someone in this moment? It may help someone to understand why there's heart disease. Yeah, there's a lot of factors to that. I get it, starting with our diet, lack of exercise, sedentary lives, you name it, we got it. But there may be other genetic things as well that we need to know about. And until you have a conversation, you'll never know. Why am I so passionate about this? Because I've seen it affect families in adverse manners, but I've also seen it give families an advantage to know when to be screened, to know when to speak up, to understand symptoms that they may otherwise just dismiss, where they can get help early and be proactive and take preventive measures rather than secondary measures that means something has already happened. Now we're playing catch up. Now it's affected us and our quality of life. It's affected our entire family. It may have even affect the longevity of our lives. It's that important. So when we talk about disparities, it's important to come to the table, have a conversation with your family, have a conversation with your children, have a conversation with your siblings, with your parents. Have that conversation. We did on yesterday, and it was so enlightening. It was refreshing. It was hilarious at points. But guess what? We learned a lot. We learned a lot. And I see them almost over my time now. But I think this is so important. And yeah, we had all ages there, young all the way up to the young at heart. And each of them were sharing. And all of us were listening. And so yesterday, more than takeaways, as far as plates, takeout plates and covered plates and all that stuff, we had takeaways for health and what we do now. And it was so nice to know that although we had those wonderful covered plates, we had just given them one of the most amazing gifts of the day. And that is accessibility to health care and resources that they otherwise would not have had. Not just the availability, but accessibility. They are two different things, and I want you to know that. Availability is just knowing it's available, knowing it exists, but accessibility is being able to obtain it. That's the difference. So when we talk about disparities, and many people will say, well, it's available to everyone. You're correct, but it's not accessible to everyone because of these disparities. They either don't know, ignorant to the fact, and ignorant is not a terrible term, it just means they don't know. And they need to be informed. But then once they are informed, this is how you can access that additional care. Patient advocacy programs. Ask the question of your healthcare provider team. What are the patient advocacy programs? If you find yourself having difficulty obtaining a treatment, whatever kind, medically, therapeutically, whatever it is, but I'm having a problem obtaining it because of finances. Are there any patient advocacy programs that I may utilize with the pharmaceutical companies? Look on the backs of your bottles of your medications. They have the name of those pharmaceutical companies. Look on the back of those bottles. If you can't read it, get a magnifying glass or use those wonderful iPhones and all those things that we have, those smartphones. Use your camera option, enlarge that picture, write down the name of that pharmaceutical company. Sometimes they have the 800 numbers or the toll-free numbers on the back of those. Get it, call them, and listen for their patient advocacy programs with respect to the medications they produce, and see how you can become a recipient. See how you can actually obtain that medication for which you may have a financial burden otherwise. It's that important. It's that simple. If not, They've got links for you, internet links. Go ahead and get them. Obtain the information. Sometimes you can fill them out online. If you can't do that, ask your children to help you. They're so good with this technology. They'll gladly help you. Fill it out and it comes to your door. There may be a portion for your physician. Once you fill that out, bring it to your healthcare team and say, this is your part here. And then mail that thing in or send it in online. Or sometimes your healthcare team will do it for you because you've done the hard work. And then just wait on your answer. That's all you got to do. It's that simple. So I wanted to share this with you on today. And I'm so glad you're here with me. If you know someone that needs this information, tell them to tap in here. Tap in here with Power Tables, the Dr. Sheri. You can visit here on Facebook or go to my YouTube channel. Like and subscribe and share it. Like, subscribe, and share it. The Dr. Sheri. This is where we bring this information to you. Because more than the tea about what's going on with somebody else's business, how about what's going on in your health business? I know, I'm going to drink this tea today. So share it with someone. Share it with your family. And don't forget the importance of the social, cultural connection at the table. It's time to bring someone to your table. I did. I brought Power Tables to you. All right. We will see you all very soon with our next Power Tables. And again, invite someone to listen to this broadcast. I'll be letting you know when we're sharing it again this month. And I'd love to see you here at our table. That's Power Tables, where you bring your lunch and, well, we bring the tea. Today we did. I am the Dr. Sheri, and I will see you all soon. Take care of your health. All right. Bye-bye.